Thank you very much. Thank you. Very comfortable here, a lot of room, and we appreciate you being here. Yesterday I announced that we would be extending our social distance guidelines through the end of April. This is based on modeling that shows the peak in fatalities will not arrive for another 2 weeks. The same modeling also shows that by very vigorously following these guidelines, we could save more than 1 million American lives. Think of that, 1 million American lives. Our future is in our own hands, and the choices and sacrifices we make will determine the fate of this virus and really the fate of our victory. We will have a great victory. We have no other choice. Every one of us has a role to play in winning this war. Every citizen, family, and business can make the difference in stopping the virus. This is our shared patriotic duty. Challenging times are ahead for the next 30 days, and this is a very vital 30 days. We're sort of putting it all on the line. This 30 days, so important because we have to get back. But the more we dedicate ourselves today, the more quickly we will emerge on the other side of the crisis, and that's the time we're waiting for. The more we commit ourselves now, the sooner we can win the fight and return to our lives, and they will be great lives, maybe better than ever. Today we reached a historic milestone in our war against the coronavirus. Over 1 million Americans have now been tested, more than any other country by far, not even close, and tested accurately. And I think what I'd like to do is ask Secretary Azar, who's done a fantastic job, to come up and just say a few words about the fact that we reached substantially now more than 1 million tests. Please. Thank you, Alex.
Well, thank you, Mr. President, for your leadership in marshaling all the resources that we have for this unprecedented testing effort. And thank you, Mr. Vice President, for leading a whole-of-economy approach to testing. As the President mentioned today, the United States hit more than 1 million samples tested, a number that no other country has reached. We're now testing nearly 100,000 samples a day, also a level that no other country has reached. I want to thank every partner that has been involved in this effort. That includes all of the men and women of the FDA and the CDC, including Director Redfield and Commissioner Hahn. Together, the FDA and CDC have worked to balance the need for testing on an aggressive scale with the scientific rigor that Americans expect. Working with our testing coordinator, Admiral Giroir, they have now truly unleashed the ingenuity of the private sector and our state and local leaders, the centerpieces of America's historic approach to testing. I want to thank those state and local leaders who have used their on-the-ground resources and knowledge to lead testing and make it much more easily accessible to the Americans who need it. I'm also grateful to FEMA, with whom we're now working closely to get state and local partners what they need. I also want to thank CMS, where Administrator Verma has given healthcare providers unprecedented flexibility to scale up capacity for testing and treatment and has ensured that tests will be paid for. Finally, we would not be where we are today without the many American companies, entrepreneurs, and scientists who have worked day and night to develop, as of today, 20 different emergency testing options. With the FDA responding to requests for authorization typically within 24 hours, the number of options is growing nearly every day. FDA has also opened up new options for using the available tests, like self-swabbing, and new options for reagents. I also want to thank FDA and other components of HHS for incredibly rapid action on other tools that we need. This weekend, we actually worked to secure 30 million tablets from Sandoz and 1 million tablets from Bayer of hydroxychloroquine and chloroquine, which are potential COVID-19 treatments, and we authorized Battelle's new decontamination machines, which can each sterilize thousands of essential N95 masks for reuse every day. So thank you, Mr. President, for your leadership, and thank you to everybody who's played a part in getting us where we are today. Thank you.
Thank you very much. Thank you. I'd like to ask Dr. Hahn to come up, FDA, because we have some really good stuff. First of all, the numbers have been incredible on testing, but in the days ahead, we're going to go even faster, and we have something from Abbott Labs, which is right here, and that's a 5-minute test, highly accurate. And I maybe can show that as we listen to our FDA commissioner, the job he's done, and the approval process. We talked about the chloroquine and the hydroxychloroquine just now. I thought that I'd mention it, but Alex has already done that. But we have that now under test with 1,100 people in New York, and it was only the fast approval by FDA that allowed us to do that. It was a really rapid approval. And Doctor, please say a few words. And this is the first one on the line of the 5-minute test from Abbott.
Thank you, Mr. President, for your leadership. Thank you, Mr. Vice President, for your leadership of the task force. I'm very proud of FDA's staff's work in the last few months to expedite the availability of testing in this country. I'm also incredibly appreciative of private industry's ingenuity and willingness to work with us quickly to develop and distribute those tests. We've had a substantial addition to testing with the authorization of point-of-care tests, especially the Abbott point-of-care test, which the President has pulled out of the box. A point-of-care test is a test that gives you a result where you're getting care. This is truly a patient-centered approach, whether it's the doctor's office, a hospital, an emergency room, an urgent care center, or a drive-by testing site. Just like tests for flu or strep, where you go to the doctors, you get the test done, you can get an answer within minutes of having this test done. Now, with those tests being approved for Abbott and for others, these are available around the country. They're planning to scale up the number of tests that can be put out throughout the country over the next month, and patients can get the answer within as little as 15 to 5 minutes. And then, of course, an appropriate plan of treatment can be given. We at FDA are working quickly with Abbott as well on other testing approaches, and normally these tests take months to develop. I was on the phone today with the Abbott CEO. He told me that normally this is a 9 to 12-month approach to developing a point-of-care test. They did this in collaboration with FDA and U.S. government within weeks. Abbott has shared that they will be delivering these tests tomorrow, and then we'll be ramping up. Just have to emphasize one thing. The most innovative and safe products come from the private sector in partnership with government, taking an all-hands-on-deck approach, just like in this case. And the other point here is that Abbott and FDA worked together to make sure that we had a fast, reliable, and accurate test to market. Thank you.
Thank you, Doc. Great job, too. Really great job. Thank you, Steve. So, the pharmaceutical company, Sandoz, has been working with us very closely. And as Alex mentioned a little bit, 30 million doses of the hydroxychloroquine to the United States government. It's been given. And Bayer has donated 1 million doses of the chloroquine, which will soon be distributed to states and state health officials around the country. Teva Pharmaceuticals is also donating 6 million doses of hydroxychloroquine to U.S. hospitals, 6 million doses. So the private sector, as you'd say, Steve, it's been amazing what's happened, really amazing. And we're going to introduce you to some of the greatest business executives in the world today, no matter where you go. And they're going to say a little bit about what they're doing. And then we have so many more. The FDA has also authorized the Batil's N95 respirator mask sterilization kits. It's an incredible thing. I've been asking, why are we throwing these masks away? You look at some of these masks and they're significant pieces of equipment, and I say, how come you throw them away? Why aren't they using sterilization techniques? And I got a call from Mike DeWine, the governor of Ohio, and he's a tremendous guy, tremendous governor, and he said, we have a company named Batil, and they're having a hard time getting approval from the FDA, and I called up Dr. Hahn, and within a very short period of time, they got the approval. Steve, we really appreciate it. I want to thank Mike, and I want to thank Steve, and they're going to be able, each machine now can disinfect 120,000 masks per day. Now think of that. Each machine can disinfect 120,000 masks per day. It'll be just like a new one. It can go up to about 20 times for each mask. So each mask can go through this process 20 times. And they have 2 in Ohio, 1 in New York, and 1 will soon be shipped to Seattle, Washington, and also to Washington, D.C. So that's going to make a tremendous difference on the masks. This morning I spoke to our nation's governors to help each state get the medical supplies they need. And yesterday, Vice President Mike Pence asked our nation's hospitals to begin reporting total bed capacity, ICU bed capacity, ventilator capacity, and vital medical supply levels on a daily basis. And Mike, thank you for the great job. Thank you very much. In New York, the 2,900-bed hospital under construction, which is now completed, they completed it in 3 days, you might say 3.5 days, at the Javits Center, will be completed today, and when you look, so they're going up, I think we're going to be adding some more beds, which will be completed today, and we've opened up, whoops, there goes our box, and my hair's blowing around, and it's mine. The one thing you can't get away with, if it's not used, you got a problem if you're president. And nearly 3,000 medical beds will become operational. The U.S. Navy ship Comfort also arrived today, equipped with 12 operating rooms and 1,000 hospital beds. Work has begun on additional temporary hospital sites, including a 600-bed capacity nursing home facility in Brooklyn and numerous floors of a high-rise building on Wall Street. So it's been really pretty amazing what they've done. The Army Corps of Engineers, what they've done, they just completed, think of it, a 2,900-bed hospital in New York in just about 3 days, maybe 4 days. And the whole city's talking about it. On top of that, we floated in a great ship, which is going to be 1,000 rooms, which is being used for patients outside of what we're focused on, and that will free up a lot of rooms for what we're focused on. So it's been great. The Army Corps of Engineers has awarded contracts for the construction of alternate care facilities also at the State University at Stony Brook, State University Old Westbury, and the Westchester Community Center. We're sending 60 ambulances to New York City today. We have a total of 60. We're getting some additional ones, with up to 190 more to follow at different locations. To date, FEMA has obligated more than $1.3 billion in federal support to the state of New York. So we're spending a lot of money in New York. It's a hotbed. There's no question about it. And we're spending a lot of time, effort on New York, New Jersey. Spoke with Governor Cuomo a lot. Spoke with Governor Murphy a lot in New Jersey. And we're really getting the job done. People are very impressed, and I'm very impressed by the people in FEMA, the people in the Army Corps of Engineers, because what they've done, I've never seen anybody do anything like it. In addition to the 8,100 ventilators that we've already delivered over the next 48 hours, we're delivering more than 1,000. We're going 400 ventilators are going to Michigan very shortly, 300 going to New Jersey, 150 ventilators to Illinois, 150 to Louisiana, and 50 to Connecticut. FEMA and HHS already delivered 11.6 million N95 respirators, 26 million surgical masks, 5.3 million face shields, 4.4 million surgical gowns, and 22 million gloves. And I don't know if you just saw, it just came over the wires that Ford just announced just a little while ago that they will produce, along with General Electric Healthcare, 50,000 ventilators, and they're going to be doing it in less than 100 days. And top of that, we have other companies that are doing ventilators, including General Motors. But we have 9 other companies doing ventilators as we outpace what we need, we're going to be sending them to Italy. We're going to be sending them to France. We're going to be sending them to Spain, where they have tremendous problems, and other countries as we can. But the fact that we're doing so many so quickly is a tribute to our great companies. More than 14,000 National Guard members have been activated and can help supplement state and local efforts to distribute personal protective equipment, where we're sending a lot. We have plane loads coming in. We have 51 loads from various locations all around the world, and they're landing. We had our first big cargo plane land this morning, and we're getting it from all over the world, and we're also sending things that we don't need to other parts. I just spoke to the Prime Minister of Italy, and we have additional capacity. We have additional product that we don't need. We're going to be sending approximately $100 million worth of things, of surgical and medical and hospital things to Italy. And Giuseppe was very, very happy. I will tell you that they're having a very hard time. Joining us this afternoon are CEOs of the great American companies that are fulfilling their patriotic duty by producing or donating medical equipment to help meet our most urgent needs. What they're doing is incredible, and these are great companies. Darius Domchek of Honeywell, you know that, and Darius has been somebody that I've dealt with in the past, and he's a great leader of a great company. Deborah Waller of Jockey International. A friend of mine, Mike Lindell of My Pillow. Boy, do you sell those pillows? That's unbelievable what you do. David Taylor of Procter & Gamble, and Greg Hayes of United Technologies Corporation. And I just want to tell all of you that America is very grateful to you and what you've done. Amazing job you've done, and we thank you very much. I'd like you to come up and say a